Okay. Uh-oh. Okay. Sorry about that. Let's get this started. And I am again going to try to do 15 minutes because I don't want to eat up your whole lives with my lectures. But let's talk about pregnancy and birth. And the first thing that we'll talk about is pregnancy. And really, we're just going to focus on two aspects of it in this talk. We're going to look at what happens inside the womb as the baby develops. We'll move through that fairly quickly, but it's very interesting to know what's going on in there, and that's part of development. And this is lifespan development, so we're going to see how this baby develops. And we're also going to look at what parents can do to help their babies develop well. So let's get started. Inside the room, no, inside the womb, I found this, I like this little video, which as you see throughout this presentation, I've got a lot of links to videos that when you click open the slides from my video lecture, you can get those links. You can click on them if you're interested. If we were in, say, a lecture and all looking at this together at the same time, I might have us watch the video and discuss it. But at this point, it's just up to you if you want to watch these videos. But here we have one that, has a little story about what happens on the inside of the womb. And it's from this video I took some of the pictures that I've got here. But let's start with month 1. And there's a couple things to know about month 1. And there are 2 stages. One is the germinal stage, weeks 1 and 2, and the embryonic stage, starting at week 2 and lasting to the 8th week or the 2nd month. Essentially, what happens during the germinal stage is the egg comes down the fallopian tube, the sperm goes up the fallopian tube, there's fertilization, the blastocyst, now that's what you call a fertilized egg, comes down toward the uterine wall, finds a spot on the uterine wall, and then the cell starts to multiply rapidly. There's a placenta that's formed, and a protective layer, an amniotic fluid is formed, and all of this is happening in the first 2 weeks. The embryonic stage is as these layers of cells, they're multiplying and multiplying and multiplying, they start to specialize. There's an ectoderm, which is the skin, the brain, and the spine. And I think it's fascinating that the skin and the brain are part of the same layer. The mesoderm is muscles, bones, and blood. That's not so surprising. And the endoderm is your digestive system, your respiratory system, and your organs. In month 2, the baby sort of becomes about the size of a raspberry, and the face and the ears begin to show. There's stubs of arms and legs, and neurons are growing at a rate of 100,000 a minute. It's amazing. Month 3, the fetal stage is beginning. This is now what we call the fetus at month 3, and it begins at 8 weeks. By the end of month 3, the baby has all its parts, and most of them are functioning. And at the end of month 3, the chance of miscarriage drops. This is why a lot of people say, if you find you're pregnant, through a pregnancy test, and you don't think it's been 3 months, they recommend that you actually don't tell a whole heck of a lot of people, because it can be very painful if you lose the baby, which is not uncommon at all. It's fairly common to have miscarriages before the 3rd month. If you lose the baby, then you have to deal with everybody else's disappointment, not only your own. So that's one of there's sort of at month 3, that's when you kind of get to celebrate a little bit and tell everybody that you're pregnant. Yay. Month 4, now is when they can call this the quickening. I don't know if you've ever heard that term, but the baby can feel the baby kick. You can feel the baby move. The heartbeat is now detectable through a Doppler, and the baby, if you look at it, it can yawn and make faces, and you can tell what gender it is. And then the baby is about the size of a pear. At month 5, now we get a baby about the size of a banana, the length anyway, it's probably a little thicker. There's a lot of movement in month 5. They're going, they're covered with hair called lanugo. And and it's a protective substance. Um, the other one of the thing that's interesting is month 5 is it's not typically seen as a month of viability, which means that if the baby is born at month 5, there's a very low chance that the baby will survive. But um, I wanted to show you this picture of this little girl who in 2007, she was a 21-week, 6-day-old baby, and she survived. But most babies that age would not. But good for her, right? In month 6, the eyes begin to open. The baby responds to sounds. The baby's actually listening to the mother's voice. We know that through experiments that we do on newborn babies where they actually recognize their mother's voice at like 6 days old. And the baby can survive, usually with intensive care, if they're born during this month. And the baby is the size of an eggplant. At month 7, now this baby's developing extra fat. It's responding to light and sound and pain. And if the baby is born at month 7, the baby will probably survive. It's more likely than not. At month 8, now you're getting, this is a Napa cabbage. You're getting a bigger baby by month 8. Most of the systems are ready to function in the world, but the lungs are still developing. So if a baby is born in month 8, there's still going to be a lot of attention given to the baby's respiration and how the baby breathes because the lungs are still working it out, right? And in month 9, now we have a baby that is just about ready to go. It moves less. There's less activity in month 9 because there's no room. So I gave you this picture of how locked in a baby is. The head drops and it aims toward the exit. Here's the head getting ready to go out the exit. But if the head isn't down here and say it's up here somewhere, that's called breech. And sometimes that may lead to either trying to turn the baby while it's still in the uterus or a cesarean. I had a cesarean because my baby was breech. But that's, now you know. Okay. Moving right along, we're doing good on our time. We want to foster good prenatal development. And there's a few things to think about. And one of them is this term teratogen. We want to know what are the teratogens in the world. And what is a teratogen? It's a factor that produces birth defects. So things that are harmful to the baby in the womb. And, here's a list for your consumption. Excessive heat. Don't go in the sauna. Herbal supplements. Just don't go to, GNC and buy some herbs to relax you because they might harm your baby. You've really got to check with your doctor. Radiation. That's why they always ask you if you're pregnant. I don't know if they ask men, but they always ask you if you're pregnant, even if you're old like me, when you go to the dentist, because if you're going to get x-rays, they don't want to zap your baby. It would hurt it. It would harm it. Sick children are also a teratogen, like getting measles or mumps or something from a child could infect the mother and then harm the baby. And cat feces. If you have a litter box, you don't want to be the one changing it when you're pregnant because there's toxoplasmosis is something that could harm it. Alcohol is something to know about. There's also fetal alcohol syndrome is a syndrome that can really harm the baby's development if you're a heavy drinker. Lead, mercury, tobacco. Tobacco is very harmful for babies, not only when they're developing, but also when they're newborns. A lot of negative outcomes associated with tobacco, smoking, or vaping. Vaping is less studied because it's newer, but still, I wouldn't do it. It's not good for you or your baby. Illicit drugs and prescribed drugs are both harmful to the babies. And I thought about putting a poison symbol right here on the beer, but I didn't. So one of the things to know that the sensitivity to teratogens changes over the course of prenatal development. So the first 2 months are the most vulnerable time. This chart is actually from our textbook, and it shows you that for example, the central nervous system by week 6, it's less sensitive to teratogens, similar to the heart. But basically, you see that the biggest time of sensitivity is within these first 2 months. Here's a link to a really interesting um, video about thalidomide babies. Essentially, I'm not going to go into it. I'm going to entice you to watch it. But there was a time when, in order to treat nausea, in order to treat morning sickness that comes with being pregnant, they came up with this anti-nausea drug called thalidomide, and they prescribed it to pregnant women over in Europe, and lots and lots of babies were born without limbs because of the effect of this. And that there's a whole story about the unethical way that it was prescribed and promoted by the drug company. Anyway, if you're interested, there's that. Other important factors associated with pregnancy is what the mother eats. So they're probably going to prescribe you folic acid because it prevents it prevents problems in nerve development. Also, there's a target weight gain, which is roughly 30 pounds, because obesity can be a problem. If you gain too much weight, that can be a problem for both mother and baby. And there's always that recommendation that mothers should just eat a variety of minimally processed foods, especially fruits, and watch out for those fish and the mercury that might be in it. Similarly, mother's age is an issue. By the time a woman is 42 years old, 90% of her eggs that are left contain defects. Because if you know, you basically have a set amount of eggs that you're going to be able to deliver over the course of your lifetime. And essentially, when you're in your 50s and you hit menopause, that's because you've run out of eggs. They're all sort of stored in your fallopian tubes or in your ovaries, and they get released into your fallopian tubes. But by the time you're 42, your eggs are old, and 90% of them are defective. Also, adolescent mothers are more likely to deliver prematurely. So these are factors that are associated with the baby's success. And now we're going to move on to birth. And there's a few things just to highlight when we talk about birth. And the first one I want to highlight is, what is labor? How do we understand what is going on in labor? And so there's 3 stages of labor. The first stage is contraction. The uterus is contracting at a fairly regular level, and the cervix is expanding. So the cervix is going from very small to what they're looking for is 10 centimeters. Maybe you've seen it in cop shows or something, where they're like, oh, she's 10 centimeters dilated. That pretty much means baby's about ready to come out. So I think that's about 10 centimeters. I don't know. So the cervix is expanding. The stage 2 is when the baby's actually going into the birth canal and moving through it. Hopefully head first, as we saw in that picture, and moving through it. So that's pretty much, all of this whole time is pretty painful for the mother. I don't know because I had a C-section. So I don't know from pain from personal experience, but we see it all over our culture. And stage 3 is when, after the baby is out, but the umbilical cord is often still attached to the placenta, which is on the uterine wall. And after the baby is expelled, the placenta detaches, and then that's expelled, and then the birth is over. There's some major choices for labor. Obviously, there's a lot more going on in labor, but that's basically the gist of it. And you can, nowadays, you can really choose what type of labor you want to have. So essentially, you can choose where. You can have birth at home. Midwives are professionals who may come in and help you have birth at home. You could go to a birthing center, which is a center that is sort of either adjacent to or off on a different special area of a hospital, where everything is a little bit nicer and calmer and smoother and less medicinal, less stark than normal hospitals are. Or then there's the hospital, which is just in the bed in, say, an operating room. That's sort of what I had. You can choose how. I don't know if they actually let you choose a C-section. Maybe that's something I should investigate. But you can choose whether you're going to take medication or take no medication, or at what contingencies you're going to take the medication. You can also be coached on breathing and be coached on natural pain relief. There are even things such as water birth. And you can also choose who is going to be there with you when you're having the baby. So the midwife, the doctor, the father. So these are some of the major choices for labor. And I'm not going to show you these, but these are fascinating. I want to recommend that you take a minute and watch some of these videos. This water birth, fascinating. Um, uh, Here's another video that I thought was interesting, which is to show you how a midwife in a birthing center, that's what they're in, this birthing center, so it's adjacent to the hospital, and these are midwives, and they're particularly trained to help you ease pain during labor and help the labor move along so that it gets over with quickly. And so this is a midwife talking to you about different positions that may be appropriate. There's also the Bradley birth, and this is the breathing, the breathing, the breathing. And it shows you how sort of the family is involved in this birth, so that it's sort of bringing the whole idea of birth as a natural, healthy, wonderful thing, nothing to be scared of. That's what this approach is all about. Here's a little bit about hypnobirthing and how, I think this is an Australian study, and how hypnosis is actually fairly effective in reducing pain in mothers giving birth. When we think about medication, the medication that is often given to prevent the woman from having too much pain during childbirth is called an epidural. And I went and I found this article that's just basically discussing the pros and cons of epidurals, and really how there was a time when epidurals were seen as like having a lot of problems, and so natural childbirth was pushed very much. But really, nowadays, modern epidurals do not impede the ability to push. Like they've been working with it over time, and they've got the dosage right, they've got the application right. There's no evidence that epidurals make a C-section more likely, and there's no evidence that epidurals drug the baby or make them in any way less alert. And there's robust evidence that epidurals make labor less painful. So there's that for you. Another thing, I'm still over time. I see it's almost 18 minutes, but we're almost done. I wanted to give you, I liked this image of an APGAR score. It allows you to sort of see how the doctors might think about a baby when it's new and coming out. The appearance, the pulse, the grimace, the activity, and the respiration. So like you're going to want a pink body, that's the best appearance. And you're going to want 100 beats per minute, that's the best beats, or greater. You're going to want to have prompt response, sneezing, crying when stimulated. You're going to want to have activity, movement, motion in a vigorous way. And you're going to want to have vigorous respiration, like a strong cry. So the doctors, when the baby comes out, they're looking for these things. If they, the 0 is, I'm sorry, but it's a dead baby. And the 1 points, like a lower score is where they may become really concerned and take measures to resuscitate the baby. Preterm infants and low birth weight it's associated with problems. So you want to have a pregnancy that goes full term to prevent some of these problems. But this is an important aspect when we think about development, right? Because we're thinking about, well, what are the conditions of this baby? It's not just the genes that you inherit, but like, were you born full term? Because being born low birth weight or preterm could impact things like learning disorders or behavior disorders, or you could have a lower IQ, or you could have a higher likelihood of mental illness or difficulty with coordination. Because if you think about it, if you're born early or if you're born with less developed, you're like, you already have something stacked against you. You're already like a step or two behind. So you're trying to catch up. Anyway, And in that trying to catch up, you could have all of these frustrations. Anyway, so there we go. I'm going to take a minute and talk about infant mortality. I want to just let you know that while we think that we've got it all figured out in the United States, this chart, which I got from another textbook that was published recently, this chart um, indicates that the United States is by nowhere near the top of the heap when it comes to infant mortality. We have over 5 deaths per thousand, and that's roughly equivalent to Slovakia and Russia. And look, we have more deaths per thousand than Cuba. I'm just saying. Also, I'll want to point out to you that their infant mortality is different for different races. And our textbook did not discuss this. And I think it's important for all of us to know that this is the way it is right now, and probably something that we should be involved in trying to stop. But deaths in African Americans have been higher since 1985, where there are deaths per thousand. Here, there's like 18 deaths per thousand in 1985 for African American mothers, and 13.8 in 2006. So even though the death per thousand have been falling, infant mortality has been falling, it's still a wide disparity. So it's something to think about, and it's also important to think about whether just racism. Nobody's mean intent. Nobody's trying to kill African American babies that I can think of, but through inattention or disbelief or the type of childcare that essentially, in some ways, maybe for people, Black lives don't matter as much as other lives, and they don't even know it. So this is why I believe we want to be involved in eradicating racism in the United States. This little chart just says, here are the states that have the highest Black mortality rate. And this is just a little chart of the states with the most anti-Black language on Twitter. It's not scientific, but it's a way to start thinking about this that says, hey, this isn't okay. I also want to point out that in the United States, parental leave, it's just nowhere near the level of other countries that are developed. So parental leave is the amount of time that a parent gets after the birth of their child. And we are given family leave. The total duration is 2.8 months, and it is unpaid. So they let you take nearly 3 months off of work, and they can't fire you during that time, but that's it. If you look at these other countries like Finland, there's 36 months. Norway, 36 months. Look at all of this. And you get paid. It's crazy what other countries do for new parents. And it's mortifying to see what little the United States does for new parents. And it just goes to show you where our priorities are. One last thing, postpartum depression affects nearly 1 in 10 mothers. Maybe it's caused by hormones, and it harms the mother-child relationship. Here's a link that suggests that if you have a mother who is experiencing postpartum depression, it's not enough to just treat the depression. You also want to do an intervention that helps the mother form the positive bond with the infant. The mother-infant relationship is so important, and we'll talk about that. That if you have a mother who is experiencing postpartum depression, you want to make sure that the intervention that you have to help that mother includes something that helps her foster the good relationship.